Hi, my name is Paul Chin with Sterling Ridge Orthopeadics. I'm an orthopedic surgeon, and today we're going to talk a little bit about shoulder pain. The type of shoulder pain that we're going to talk about today is shoulder arthritis. Now, you may have heard of arthritis before, and in arthritis, what happens is the joint deteriorates. So the shoulder joint with the glenohumeral joint, which is the glenoid, which is the socket here on the shoulder blade, and the humerus deteriorates. So the cartilage breaks down, the joint gets stiff. Most cases, the muscles of the shoulder, which are shown here as these kind of orangish structures, the muscles are intact in most cases of shoulder arthritis. And so what patients feel most commonly in their 50s, 60s, and 70s as they're developing arthritis is they feel stiffness, they feel pain when trying to move the shoulder and use it. They have difficulty doing activities such as golf or gardening or even just reaching overhead. And when it gets really bad, they start getting pain at night, pain when they're not doing anything. And so we diagnose shoulder arthritis most commonly, obviously by listening to the symptoms that the patients are having, getting an x-ray. We x-ray the joint, we look and see if there's joint deterioration. Sometimes we'll see the ball and socket joint kind of narrowing and decreasing, and so that's how we then diagnose arthritis. Sometimes there's bone spurs that we see. And so when we diagnose it, there's different treatment options. The most common treatment options are using pain medicines like Tylenol, anti-inflammatories. Occasionally we'll do some physical therapy to try to improve the strength of the muscles that are getting affected by the joint destruction. And then one other thing we start to use is injections. And injections can be helpful for some amount of time, varying from weeks to months to even years in some patients. But eventually the joint continues to deteriorate, and then when patients come and see me, they're usually having pain all the time. Their motion is really limited. They can't even raise it past 90 degrees and they're ready to move on to something else. And so what we do for an end stage, this shoulder, arthritic shoulder, is we do a replacement. So I have two models here. One model is the standard shoulder replacement that we've used for many, many years, way back into the 50s and 60s. We've got a long stem here that goes into the humerus. Here you can see it would go all the way down into the humerus, and then it has a metal head that goes on top of where the arthritic head would be. So that's the first part of the replacement. The second part would be a plastic socket that goes on the glenoid side, and so that dynamic, the metal ball and stem and the plastic socket, make up the new joint. And so there's frictionless motion again, we keep the muscles intact, and that surgical procedure takes about an hour to do. Full recovery takes about 6 to 9 months. The patients have good use of their arm again, they have good strength, and eventually can get back to doing the things that they would like to do. Now, one thing that we've been doing for the last probably 10 years is using a prosthesis that's much shorter than this full stem. This is called a stemless design. And the reason that we moved to a stemless design was because we found that we didn't need that long stem anymore. And the side effect of that is a little bit quicker recovery, less pain after surgery, and very, very few, if any, complications related to using this short stem. So with this short stem, now we found that we can use this shorter stem in more than 90% of our patients that have run-of-the-mill shoulder arthritis, and their recovery is a little bit quicker, a little bit shorter surgical time, and get back to full function, hopefully within about 6 to 9 months, as I mentioned before. So if you've been having shoulder pain for weeks or even months, book an appointment, we'll get an x-ray, we'll hope that it's not shoulder arthritis, but if it is, we'll start treatment, we'll get you into physical therapy, maybe even an injection, and if it's not getting any better, waited a long time, or if you've had this for years, come in and we'll talk about the options, whether you're a candidate for a shorter stem, traditional stem, and hopefully we'll get you feeling better quickly.